Okay, I think we're all here. Great. All right. I think Alexis has one more announcement before we get started.
Let's see, we're all back. Let's see, we started recording, no more announcement. Oh, I do, you're right, I'm sorry. If everyone can please put their information, like their name, organization, like position and contact information in the chat, that would be great. So that if you're willing to share it, if not, that's totally fine. But if so, just throw it in the chat so we can all see who's here. And next up, we have presentations. First up, we have Work to Future. I believe Maria Luisa is presenting. Do we have Maria Luisa here?
Yes, you do.
Awesome. Kelsey, can you make her host, please, or co-host?
She can share her screen.
Oh, okay, perfect. So you should be able to share your own screen, even though you're not a co-host or anything.
All right. Are you guys able to see my screen?
Yep, you're good to go. Thank you.
Yeah, perfect. Okay. Well, thank you guys so much for tuning in today. Again, my name is Maria Luisa with Work to Future. I also have my coworkers Griselda and Christina on here. So if you have any questions during this presentation, feel free to just drop it in the chat. They'll be more than happy to answer them. Okay, so Work to Future is a job center of California. We help Santa Clara County residents get the skills and the coaching they need to find a new job, have a career change, get some training, and then we also partner with employers and connect them with our network of job seekers. So it's like a two-part. One, there's us career advising, and then there's the part where we partner with different employers to help them find employees. So we offer a lot of career coaching for the participants. So it's a lot of career exploration. They have access to workshops to upskill any of their skills. We offer paid internships, on-the-job training. We have some vocational training, and we offer some financial and non-financial resources and supportive service. So for example, if a participant can't pay their rent or have access to interviewing clothes, we help them with that too. So all of our different workshops cover, different ways to showcase themselves, how to present themselves in an interview, work on their resume and cover letter, different topics to discover what soft skills employers want. And one of our workshops called Cafe Connections, that's where we have peer support and we talk to different employers. That one's been put on hold due to the current pandemic, but we're hoping to start that one in the coming months. So right now, you guys are even able to see what kind of jobs we have available. If you just head over to worktofuture.org, you'll be able to see our current job posting, and it's constantly getting updated and changed. So what you see today might not be what you see tomorrow if that position gets filled. So if you just head over to worktofuture.org and you scroll down, you'll be able to see our job board, and it looks just like this little image here. It says looking for a job. So here at Work to Future, we also partner with other programs and organizations where we get referrals, and we also are able to refer our own participants, such as the Trade Orientation Program, the TOPS program, PG&E Power Pathway, Goodwill, Conexión, Career Village, and we have access to LinkedIn Learning. So it's a great way to help our participants coming in who may not, they may not even have a LinkedIn account, but it is something that employers look at. So we're able to guide them in the way to create that and offer LinkedIn Learning for free to them. So We serve 2/3 of the Santa Clara County, San Jose, Gilroy, Campbell, Morgan Hill, Saratoga, Los Gatos, Stanford, Los Altos Hills, San Martin, and Monte Sereno. So if you have anyone who you may think of within this area, we're more than happy to help them. And if we are unable to help them, because of their location, we'll be happy to refer them to another job center where they can get the assistance that they need. Like I said, we have supportive services available to all eligible WIOA participants. And, these are sometimes essential to helping them reach their career goals. Like I said, we have interviewing clothes. If the person needs to purchase some work uniforms or some tools, or if the person wants to go back to school and they need help with their textbooks, we will offer a small stipend for them to purchase their textbooks. Any rent and utilities assistance as well. So for those of you wondering, how can we get our participants to enroll? How do they enroll? It's a pretty simple process. The first step is just to set up an informational call with one of the career advisors. And then the participant will be able to come on site and meet with that career advisor and create a CalJobs account. And we go through a quick eligibility checklist. They're able to bring their documents. And then from there, we create their individualized career plan, which is about their goals, what kind of employment they're looking for, or training, and we're able to take it from there. So just some of our eligibility requirements. They do have to be 18 years of age, have right to work documentation in the United States, have proof that they are a Santa Clara County resident, any school records. It doesn't matter if they did drop out from high school or they never got to high school or they have a bachelor's, just some verification for that. If they are male, that they have registered with Selective Service, and then meet one of our barriers. And we have just a list of barriers that we go through with that person on a one-on-one basis. Again, this is just thank you for tuning in with us. To get started, definitely just reach out to one of our career advisors. My name's on there, and my coworkers who are on here, their information's here. Feel free to email us if you have any questions or give us a call, and we'll be more than happy to help. I'll leave that up there for another minute in case you guys want to write that down.
Thank you so much for this. Does anyone have any questions for Work to Future? Was there any in the chat? Doesn't look like it.
Hi, I don't know if you mentioned this. How long is this program, or how long?
Yeah, I didn't mention that.
Okay.
So that's a good question. It's as long as the participant, requests help.
Okay.
So it's not that we don't have a set time, like a 2, 3 month, 6 months. Ideally for us, we like to, help them build their resume, help them have a job, see that they're able to retain the job for a set amount of time. And then, we close the case. It's not like that for everyone. Sometimes they need more one-on-one assistance. And so it takes a little bit longer, but we don't have a set period of how long the program lasts.
All right. Awesome. Thank you.
I have a question. Are you looking for donations? I was just on a Zoom last night. A woman was clearing out her closet and wanted to donate her professional clothes and shoes to an organization just like you guys.
That's a good question. We have to ask just because of COVID reasons, and we just got back into the office. Is there a way that we can get your email so we can get back in touch with you about that?
I put it in the chat. My name is Jenny Bader.
Perfect.
Thank you. Yeah, thanks.
Anyone else with questions? If not, I took a screenshot of all your guys' contact information that I will send out with the follow-up email that I will send out. So you can just you can reach out to them that way if you didn't have a chance to take down that information.
Could we also get the slides in whole? Someone's asking me privately for them to be sent in the email, if you guys don't mind sharing those slides that you just presented.
Yeah, I'll go ahead and email them to you.
Okay, thank you so much.
Perfect. All right, next up then we have Center for Employment Training presenting about La Coupe Wildfires Program. And Celia, we have you presenting. I see you. Perfect. You should be able to share your screen, so you should be good to go.
Awesome, thank you guys. Yeah, I'm Celia Hare from Center for Employment Training. Let me get my screen shared.
Love that you use Canva. Just gonna throw that out there. I love
Yeah,
Canva.
I love Canva. So convenient.
Yep.
Okay, so as I said, Celia Hare from Center for Employment Training. I'm an outreach recruiter intake here. And my position is basically doing outreach for the project we have going on in response to the 2020 wildfires that happened last August. So Center for Employment Training, we're a nonprofit organization based out of San Jose. Our location is on Vine Street. I have the address coming up in a couple slides. We've been helping the community since 1967. We've worked on many federal and state declared disaster response programs, such as the Southern California wildfires. We have a COVID program going on right now. We're primarily a skills-based training center, but we also offer supportive services and job placement in response to these natural disasters. And CET has helped thousands of individuals jumpstart their careers. And our main goal at CET is to get the community working, which is exactly what the temporary jobs program is designed to do. So here is a list of some of our programs we offer at our Vine Street location in San Jose. We also have other locations. There's one in Coachella, Colton, El Centro, El Paso, Oxnard, San Diego, Soledad, Watsonville, and Alexandria, Vermont. So yeah, those are all the programs we have. And if anyone is interested, feel free to call that number down at the bottom or visit our website. You can input your information and we'll have one of our admissions counselors get back to you and see if we can get you enrolled. Financial aid is available for those who qualify. And there's that address of our Vine Street location. And we're also sending out a flyer with all this information after the meeting in the SPN email list. All right, so our mission for the temporary jobs program is to assist the communities that were impacted by the 2020 wildfires within Santa Clara and San Mateo County by creating temporary jobs cleaning up burnt debris. So our project is funded through the National Dislocated Worker Grant. The funding is provided by La Cooperativa Campesina de California and the Employment Development Department, the EDD. They've worked together for over 30 years in coordinating disaster response and recovery operations. And they work together to provide oversight for this project. So everything has to be pre-approved by them, and they provide all of the workers' compensation and payroll liabilities. It all is through La Coupe and the EDD. So for our project, we're looking for temporary workers. And as it says on the slide, workers can work 800 hours or $12,000 in earnings, whichever comes first. So we're looking to hire for these temporary positions. And currently I have a contract going on with the California State Parks Department. So we're looking to hire people to come in and clean up some of the state parks that received damage to the fires. That includes Butano, Año Nuevo, I think Half Moon Bay State Beach. That's just a few of them. So we're looking to get people hired in to help clean up the park, as well as help keep the park running smoothly during their busy season. So it's a really cool opportunity to get working outside and make a difference and make some extra money in the process. Let's see. So qualifications for these positions: anyone whose job has been affected by the 2020 wildfires qualifies. Anyone who's been displaced from work from the fires, or people who have been unemployed for 15 weeks out of the previous 26, which is considered long-term unemployment. So if anyone's been unemployed for 15 or more weeks, they should qualify for our program. And as I said, it's working with the state parks. So it is a lot of fire damage cleanup, debris removal, and trail repair. So they must be in good physical condition. We don't require any prior knowledge of fire cleanup, anything like that. Training is provided through our program. They just must be in good physical condition and just be enthusiastic and ready to work. Let's see. So here's all my contact information. I also left it in the chat, and I believe there's a flyer going out. There's one going out for Center for Employment Training that includes all of our programs, our website, and then there's also one for the wildfires program. So if anybody knows anybody who is interested in the position, definitely reach out via email or phone. Either one works. So yeah, thank you guys so much for listening to my presentation. If anyone has questions, feel free to reach out or, leave them in the chat.
I have a question. Do you guys hire individuals with felonies?
I believe we do. I'd have to check on that. As long as the workers have proper identification, I believe we do hire that. I don't think the background will affect their employment opportunity.
Okay, awesome. Thank you.
And I'm not sure if you said this, but you just said that they need the proper documents. Does that Social Security card? Can you explain what all those documents are?
Yeah, so to be hired on, you need a state issued ID and a Social Security card or a passport. You just need 2 forms of those IDs.
Okay, thank you. This is a wonderful resource.
Yeah, we're excited to get people working. That's our main goal. And hopefully, long-term employment is like the main goal of our program. It has happened. We've worked with the state parks in the past, and there were a couple workers that ended up being hired on after their temporary employment ended. So that's always our main goal. But yeah, we just want to get people working and get the community cleaned up.
Any other questions for Celia?
Is there any program to clean up the trash around our community?
Unfortunately, we don't have one yet. Not that I know of.
Jenny, that's where we come in.
Well, the community, I see, on the next door, just chains of chatter about what can the community do to clean up the trash. And actually, Heather just sent me a link yesterday about some organization that does something like that. But I mean, it'd be great to spread the word and say, donate to CET. They'll provide jobs for people to go clean up. And yeah, Heather didn't think that downtown streets, it's for employment, right?
Yeah, no, we are also, our main goal is employment, but at the same time, also the volunteer component of the street cleanup and those projects. But we also have very specific project areas that we're funded through contracts and whatnot. So outside of those, we aren't able to do that much because we're not getting paid to clean up the area. So there's a lot of stuff that goes into that. We do great work in the areas we're in. But
it's a little slightly twist than what Cecilia was talking about. Like, she's promoting people who have been affected by maybe COVID, lost their jobs. They're not homeless per se. It'd be great. You guys put together a program similar to the wildfires, but just cleaning up the trash right here in our own community.
Yeah, our program is funded by La Cooperativa, so we have specific obligations that we have to follow under the contract. But that would be a good idea for a different contract.
I'm sure I could get a lot of all of us could get a lot of donations from the community to get us program started, because people want the trash picked up.
all right, any other questions? And Celia did send me flyers that I will send out after, with the follow-up, and I'll put her contact information in there as well. Celia, if you would like to share your slides, you certainly don't have to, but if you'd like to share them, you can also send them to me and I'll send them out as well. But yeah, that being said, thank you so much, Celia. Next up, and our final presentation for the day, is New Directions, and we have Liz presenting on behalf of New Directions. There you are.
I'm here. Hi, everyone. Good morning. Thank you for inviting me to present today. So can you guys see my PowerPoint okay?
Yep.
Great.
You're good to go.
Cool. So who am I? So I am a clinical supervisor with New Directions. We are a program of Peninsula Healthcare Connection. I will be sending out the slides after. So if you guys have questions, you can reach out to me directly. That's my work cell phone number as well as my email. What I wanted to do today was I wanted to explain what our agency is, how we are connected to our master agency, Peninsula Healthcare Connection, and talk about our relationship with our sister agency, DST, who is here. Hi, Alexis. Hi, Kelsey. and then talk about how our program can support your clients potentially, as well as if you come across working with us, what that means, as we have a few different primary functions. So just to start, I want to be very clear. I work for New Directions. We are a part of Peninsula Healthcare Connection. It is a 501c3 nonprofit. This is a corporation that was started in 2006. Peninsula Healthcare Connection has two main components under it. The first is the clinic, which many of you know as the PHC clinic. This is located in Palo Alto at the Opportunity Services Center. A little fun fact for those that are interested, especially on the medical and licensing components, is that it is the only full licensed medical facility that provides free direct healthcare and psychiatric services to homeless and low income residents in Palo Alto. It is also a FHQC lookalike designation. So that's a fancy bougie term that we have done some things to have a certain status in terms of us meeting markers for quality client care. Some of the services that PHC offers include primary care. There's some specialty. They provide psychiatry. They are also doing weekly COVID vaccination for anyone who is interested. You don't have to be a regular patient of PHC to receive vaccination. And also some therapy services from a retired MFT. I will say, just as a quick note for any of you who have clients who are already connected, or you think may be good to be potentially connected there, is that they are primarily staffed with medical doctors who work at PAMF, at Stanford, at Valley Medical. And so these are really doctors who love what they do. They love working with the population. They really want to support individuals who identify as, you know, being homeless, low socioeconomic status. It is a very small clinic. And for some, you know, walking onto the Opportunity Center campus can be overwhelming. So just to keep that in mind, if you do think about, wow, this might be a good resource for a client of mine, that it is co-located in a drop-in homeless services center setting right across the street from Town and Country in Palo Alto. But again, they're really wonderful people. They do the work because they really want to support the mission of helping those get medical care. New Directions, which is our program that I'm part of, we are a nonprofit that is staffed primarily by social work case managers. We are distinguished in working with homeless and low income populations in Santa Clara County. We are kind of known as sort of the unicorn of medical case management agencies, and I'll go into that in a little bit. Our agency is under Peninsula Healthcare, and as I mentioned, we are also a sister agency to Downtown Streets team. Our executive director is Eileen, who is very involved in the other programs. So here's just, if you've seen the logos, DST, New Directions, and this is our medical director, Dr. S. at the clinic. In terms of our agency, we are often asked these questions a lot of, who can you work with? How do I get someone to work with you? What do you guys essentially do? So we're a contractor agency, and that means that we do not take self-referrals. Unfortunately, if someone were to call us and say, hey, I heard you guys provide case management, you work with people, can you help me? We have to and are only able to accept referrals from clients that come through one of the following organizations that are listed here. So these include, you know, Behavioral Health Services Department at the county, Office of Supportive Housing, OSH, one of the managed medical health plans, Santa Clara Family Health Plan, the VHHP program, El Camino Hospital, that's inpatient psych and medical. The home health program, which is part of Santa Clara Family Health Plan, that is a pilot initiative that I'll talk about in a little bit. And then the medical respite program. Medical respite, for those of you who aren't aware, is a program that is staffed by VHHP personnel that provide a hybrid low-level pseudo shelter combined with outpatient medical follow-up for those that have literally just left the hospital that are chronically homeless but medically stable to leave the facility of a hospital but need a little bit more support before they transition into a congregate shelter setting. Our agency is divided into divisions. And so some of you, I recognize you've worked with some of our staff. I wanted to kind of give a very quick conceptualization of how our organization is broken up. So we have our medical pod, and then we have our CCP pod. CCP is the Care Coordination Project through Office of Supportive Housing. So our staff, our direct services staff, are primarily divided into one of those two divisions. We also have our administrative pod, which at the top is our program director, Heather, and under her other administrative staff, including one of our colleagues, Jenny, who's on the call today, who is our housing specialist. So in terms of the core services that our agency provide, we are community-based. Prior to the pandemic, we were in the field the majority of the time. So we kind of jokingly say to each other that it was not uncommon for us to be essentially having our office in our car or in the field. We were meeting clients where they're at. We were accompanying them to appointments, going to their homes, meeting them in encampments in the community. Since the pandemic has happened, we've had to pivot and become a hybrid model where we are a combination of telehealth as well as in-person services. And we have really had to assess each client and their scope of support as well as isolation and vulnerability, and then make plans accordingly. The core services that we provide are really centered around a complex care and intensive case management model. And the domains are listed here. Again, as I mentioned, care management, care coordination, that cuts across all of the biopsychosocial domains. So it's physical, behavioral, community-based long-term support services. I should say care coordination is very much about linkage. We are not a clinical program. We do not provide therapy. We are really seen as the person that helps to assemble the team. We also really focus on health promotion. For those of you that work in any medical capacity, you may have seen that social determinants of health have become a very important evidence-based driver in the provision of medical care, regardless in the setting. So our agency is very vested in looking at what are the social determinants of health that impact someone's medical or mental health, as well as physical health, and how can we offer support services that either take a harm reduction approach and or educate clients on the scope and nature of their medical mental health illnesses, and really empower them so that they can hopefully make the best choices for their own health and well-being. We also do comprehensive transitional care, which essentially is a fancy way of saying we follow people through inpatient to step down care and hopefully back into the community. Again, before the pandemic, it was very common that we would walk into a hospital inpatient setting. We would collaborate with inpatient staff. We would start at the bedside with the client, and then we would follow them through and make sure that aspects of care was not dropped or forgotten. Oftentimes readmissions are due to simple things such as a lack of medical reconciliation and a client not getting their medication and they go back to the emergency room. And so that's something that our team is very focused on with that transitional care, making sure that those simple things that can be easily overlooked are not the reason that the client is readmitted. We also really try to look at the person and environment and engage any supports and family. Evidence in this area, as well as our agency, which started as a pilot research project and became a nonprofit, has really shown that engaging the identified client's supports, especially when it's safe and appropriate to do so, helps the client feel more engaged because they are not just hearing supportive advice from a social worker or case manager, but they're also hearing from those in their personal life that they love or care about, that there is a team here to support them and that everyone is on the same page. As I mentioned earlier, we are very focused on linkage. We do a lot of referral to community and support services. We, in this spirit, do not dump clients. So when we refer someone to an agency, we very much so want to make sure that the client is in agreement with this, and we ask the client to tell us, how can we support you in the linkage to this agency? Some of our clients are very high functional and they're like, no, just refer me and I'm good from here. Great, no problem. Other clients say, I'm a little bit anxious or concerned about going to another agency. I'm fearful they're not going to understand me. I'm not going to say the right thing. I might not get into the program. We said, that's fine. We can be there as a support and walk with you in that journey to link. And with the client's consent, we will help the client in communicating to the prospective agency we're referring them to what our role is and what the client's hope is in getting connected to an agency. And then lastly, we provide housing navigation services. That is not only inclusive of our housing navigator, Jenny, who's been a part of this collective. Our agency is also one of the many that is trained to administer the VI SPDAT. We do that very routinely because we have such a high volume and percentage of our clientele who are chronically homeless. We also are a partner with the Homeless Prevention Service where we can do the PRVI SPDAT. Because we are a small agency and a contractor agency, at this time we are only able to offer the PRVI SPDAT to our clients. And the PRVI SPDAT, for those of you who aren't familiar, that is Homeless Prevention Services for those that are at imminent risk of loss of housing due to financial reasons or complications. In terms of differentiating our two divisions, earlier I had shown the little bubbles of our pods. I wanted to do a very brief sort of like distilling of compare contrast. What does our CCP division do versus what does our medical division do? I also want to say, as I do this distinguish and talk about this, is that our medical division is not an HMIS, with exception of if we were to administer a VI SPDAT and or offer them an uplift free bus pass. You will not see clients in our medical division as a program enrollment in HMIS. And the reason for that is our medical division has contracts with managed healthcare and hospital systems. And it's an issue regarding HIPAA because in that way we essentially operate as an extension of healthcare for the client. So it's not appropriate for us to have the client as a program entry in HMIS. This has at times caused a little confusion for other providers who do encounter and enroll clients in HMIS because the client and or us might reach out and say, hey, we're New Directions, we're serving this client in our medical division. And the other provider may look in HMIS and say, we don't know who you are. So we do a lot of education around trying to clarify our two divisions. So our first division here, the Care Coordination Project Division, which we lovingly refer to as the CCP Pod Division. These are all clients that are referred to us through the Office of Supportive Housing. So what that means is any agency in the County of Santa Clara that is trained to do a VI SPDAT and is sent to the queue, if they get pulled and they get determined eligible for housing, we are one of about dozen agencies that is contracted with the county to provide ICM services. So every client that comes to us under our CCP pod division is going to get ICM services with a housing subsidy, whether that's through a BODE or housing authority. This is a long-term service. So we will work with clients throughout the course of their housing subsidy. As long as we retain the contracts with OSH and with the county, they are our client. We support them. So it's very common, and we've had clients over 10 years that we've worked with that we have very long-term relationships with. Our approach is to stabilize them with the housing first model, as I recognize some of the other contractors that are represented here, very much similar approach. After housing and in conjunction with housing, we also are very focused on linkage to supportive services to help prevent jeopardization of housing retention. We really want to focus on teaching, coaching clients to optimize their independence while having a consistent presence in their life. So knowing that people that are chronically homeless often have other comorbidities or co-occurring issues around complex trauma, substance use, grief and loss, medical, mental health issues. there is going to be obviously a transitional time where the client will be given this beautiful opportunity to be housed, but may not be ready to address some of these other areas that will help them not only improve their health and well-being, but promote more independence. So we have to work with clients over time and really meet them where they're at. Sometimes it's successful, sometimes it's not. And the client will get housed and they will make choices which we see are probably not the healthiest. And then in that case, if there are the ultimate consequences of evictions or notices, we facilitate that rehousing. And as I mentioned earlier, because this contract comes with specific metrics, we want to make sure that we're not only linking the clients to those basic services, but we're also monitoring the maintenance, because something that I'm sure many of you know is that those that have, chronic ongoing challenges have struggle independently monitoring, tracking the responsibility of maintaining those supports. So it's very common that oftentimes our clients might miss a Social Security recertification, CalFresh, Medi-Cal, food stamps, so on and so forth, and they might temporarily get cut off from that. So our team also makes sure that we are kind of in the background watching to ensure that clients aren't losing resources. And our medical division, jumping over now, I'm the clinical supervisor under this division. This is also intensive case management services, but it's much shorter term. It's 6 to 12 months. I did see a message in the chat about our ability to be connected with HealthLink. Although we are a contractor of health and hospital systems, unfortunately, we do not have access to HealthLink. So that is a complicating factor to us. However, we are very good with our medical team. We are licensed clinical social workers or master's level social workers, with coordinating very closely with medical providers to work around that lack of access to the health record. Our medical team are referred clients, and right away we are assessing and prioritizing what are the basic needs. And we very much have the philosophy in the medical team that we are building the team. And after we build the team with and alongside the client, we sort of serve as the quarterback. If you want to think about it metaphorically, we are getting everyone together and then we are determining who is going to do what in support of the client. And so that's very helpful, because to prevent client confusion of having different providers involved, it's helpful for us not only to link, but to make sure that everyone that's involved is understanding of each other's respective role and what their primary goal or goals and supports are going to be to the client. It also prevents triangulation and manipulative behaviors by clients who have mental health issues or pathological behaviors, so that the client can get what they need, that people are maintaining boundaries, and we're really wrapping around the client. We also really want to coach and teach clients to use these formed teams so that we can start to transition back and watch this new team start to really step in and lean into working with the client. If the client is homeless or needing housing or rehousing supports, we will refer them in-house, or we will utilize VI SPDAT or potential other resources. I will say, because of our medical division getting a lot of referrals where they're medically complex and they're not able to work, as many of you probably come across, we often get clients who have that Social Security rate of 900 and change, and they do not want to live in shared housing, and they may not be ready to accept the reality of the cost of living in the county of Santa Clara. So we, have to have some hard and, difficult conversations and letting clients know that unfortunately in our medical division, we do not have housing. And that we understand the need for them to be housed, and we offer them and link them to what we know is available and that they are financially able to maintain. And then lastly, we are very big on care coordination for transitions of care. That's not only if a client has an acute medical setback or a new medical condition that comes up, as well as we come to that length of stay and we're going to transition them out to another agency or program, we are involved in facilitating that warm handoff to prevent that gap in care so that the client doesn't have setback and continue forward, hopefully in the positive trajectory. In terms of the big question we get, can I refer someone to New Directions? So as I mentioned earlier, all of our clients need to come to a contractor. again, just so everyone's clear, for people that come to us that have a housing subsidy, it's all funneled through OSH. As many of you know, it's a coordinated entry system. So if the client does not have a subsidy, if they're not referred to us through OSH, we do not have housing available. We do not have subsidies. In our medical division, these are the following entities that we take referrals from. El Camino through their inpatient medical and mental health team, through Valley Medical Center through the medical respite program, through Santa Clara Family Health Plan. This is both on the behavioral health and the medical side. Those referrals come through case managers that do telephonic care coordination and may find that their client or at the health plan, they refer to them as a member. Their member is too high need, and or they feel that they need to have a community-based provider to get an eye on the client and get a better assessment to capture what's going on. And lastly, through the Health Homes contract. I wanted to just take a moment to explain Health Homes, because this is a potential way if you have a client that is 18 and older that is having medical challenges that may benefit from case management, and you have found difficulty or challenge in getting them connected with case management. The state of California launched a pilot project called the Health Homes Program in 2019. And this was in response to Medi-Cal recognizing that there was a gap in care for clients who were struggling with chronic medical issues and or vulnerabilities around level of utilization in the hospital. So what the state of California did was they created a program that was later called Health Homes, and it is all facilitated through the managed care health plans in each county. So in our county, Santa Clara Family Health Plan and Anthem both participate in this program. And what happens is a client can be referred to Health Homes if they have certain chronic medical conditions and they have an acuity factor. An acuity factor can be they have multiple chronic conditions, they're chronically homeless, or they've had a hospitalization overnight or multiple emergency hospital visits in the last year. Clients can self-refer to Health Homes if they are A, active Medi-Cal, B, paneled to Santa Clara Family Health Plan, and are not share of cost or not CalMedi Connect. I'm going to send this information in the slides so Alexis and Kelsey can distribute it. I'm always happy to answer questions. I want to just say I do not work with the health plan, but we are one of the contractors of the health plan, and we're often asked questions. Is this a good resource? And so we're happy as best as possible to answer those questions. You'll notice this green arrow halfway down the referral form, and it says community-based care management entity. We are one of about a half dozen entities in the county of Santa Clara with Santa Clara Family Health Plan that is contracted to provide services through the Health Homes program. There are other agencies that may or may not be represented here today, inclusive of Gardner, Roots, NEMS, etc., who also do this program. So we respect their work and being one of the care management programs that is contracted alongside of them. If you want to refer someone and you would like them to be paneled to New Directions, all you need to do is write that you would request New Directions in there. It's not required, it's just optional. There is also a flyer that will be in the PowerPoint that is a very simple, easy to read, easy to look at visual of what this program is. It is also co-branded with the health plan and our logo. Again, I will say that this is a program that has been in existence for 2 years. At the end of this year, the state of California is going to be launching CalAIM, which is going to essentially be a rebranding and an expansion of Medi-Cal and long-term support services under the name of Enhanced Care Management and in lieu of services. So any client that is enrolled at Health Homes at the end of December will automatically be grandfathered into this new program. We don't know all the details yet of CalAIM. However, we have a suspicion that it might open up additional avenues and additional populations to be referred for enhanced case management. Our agency is going to be participating as one of the contracted providers of medical case management under enhanced care management through Medi-Cal. So Alexis and Kelsey, I'm happy to come back later in the year or next year and share about that as, you know, we learn more and get ready to launch that program. So there we are. I've talked quite a bit. Any questions for me?
Liz, you said you'll send me a copy of that flyer that's not necessarily, it's the referral form, but has to go through the doctor?
Absolutely, yeah. So
Okay.
either the doctor can refer the client, one of you as a provider can refer the client, or the client can call Santa Clara Family Health Plan and self-refer. And again, even though we're not contracted with Anthem at this time, if you have Anthem clients that meet that criteria, they can call Anthem Member Services and ask to be referred as well. We're just not a
Oh.
participating agency with Anthem at this time.
So they would be referred to another community-based organization. Okay. Okay.
Absolutely, yeah.
Good to know. And if you'd like to share a PowerPoint as well, you can send that to me too. So just, you know, send me that, whatever flyers that you want to go out, and I'll make sure they go out with the follow-up email.
Wonderful.
Any other questions for Liz? And Liz, it's okay to share your contact information in that follow-up email as well?
Absolutely.
Okay.
Feel free to reach out if you have any questions.
Perfect.
Thank you.
Thank you so much, Liz. Wow, we heard a lot of great resources today. Really happy about that. So thank you to all of our lovely presenters. Next up, we have, let's see, next up we have the open communication section. We have about a little more than 10 minutes for this if we want to use that whole time. This is a great forum for any resource sharing or any updates you'd like to share with the group. You can share any successes or challenges, or if you need help problem solving for a specific situation, if your agency has any COVID updates or any questions about COVID vaccines or testing, this is a perfect time to share any and all of that. Okay, well, I'll start. So actually, let me pull up the flyer real quick. There is free animal care. Here, let me pull it up before I talk about it. Okay, for people who are experiencing homelessness, there is a free veterinarian clinic on May 16th. So what is that? Is that Friday? No, on Sunday, May 16th. And then another one on June 20th. It's in San Jose at the Happy Hollow Park and Zoo parking lot by the Kelly Park Disc Golf Course. But they offer a bunch. It says it's from 9 to 2. They offer a bunch of services. It's a partnership between Humane Society of Silicon Valley and Street Dog Coalition. They will have free spay and neuter for dogs, cats, puppies, and kittens. It includes free vaccinations and microchipping. Looks like there's a specific drop-off and pickup times for people who need spay and neuter services for their pets. There's wellness checks, vaccinations, microchipping, parasite treatment, ear cleaning / infections, flea and tick prevention, nail trims, basic medications, pet food, free pet supplies, wound care, and additional services. I'm reading off this flyer here that has it in both English and Spanish, and it has a map showing where it's located along with some bus routes nearby. I will go ahead and throw that in the chat now, and I'll probably even send that out ahead of time, like before. I'll send it out with the spin follow-up, but also before the spin follow-up, because I usually don't get that follow-up done, that email done, until early next week, and this clinic is on Sunday. So I want everyone to be able to share this with their clients and take advantage of that before I'm able to get this email out. So I've shared it in the chat for everyone with us right now. It is loading. And yeah, so please share with your clients. I hope they're able to take advantage of this wonderful service. The only other thing I wanted to share was just about the vaccine clinic at the Opportunity Center in Palo Alto that Liz mentioned in her presentation. I also put that flyer in the chat, and it will be included with the follow-up email. It's free to everyone, and every Friday from 10 to 1. It's better to get there towards 9:30 or 10 though, in case there's a line and they run out of appointments, because it's first come, first serve. But no appointment needed, no documentation needed, like no ID, nothing. So it's a really low barrier way to get your clients or family members or friends, anyone really, to get their vaccines. Anyone else have anything they would like to share? And if not, that's okay. Kelsey and I will stay on till 11. We'll keep this Zoom going. If you don't want to stay on and don't want to chat with anyone, that's totally fine. Thank you all so much for being here, taking the time out of your Wednesday to join this meeting. We hope to see you next Wednesday and again, or next month. And again, please let us know if your agency is interested in presenting at one of these SPIN meetings. So thank you all for being here. Feel free to take off, but also if you'd like to stay on, we'll be here.
Thank you, Alexis.
Thank you, Damien. I'll be reaching out to you.
Okay, sounds good.
All right, thank you, everybody. Bye.
Thank you, Stephen.
Yeah.
Hello.
Hey, Franklin.
Hey, this was a pretty neat experience. This is actually my first time on a SPIN meeting.
Mm-hmm.
So I don't know. I think you two did a great job, like just speaking and communicating with everybody. Girls.
Thank you so much.
Yeah, thanks.
I
Thanks
noticed
for
that there were,
joining us.
you know, there's like, you know, people have things to do, or I don't know what they're doing, but you know, just like contributing and wanting to speak. Like I said, you guys killed it.
Thank you so much. And I think you are, maybe not you, but your program is presenting next month?
Yeah, I may or may not be a part of it. I just got promoted to a new position here, so I don't know,
Okay.
that'll be me speaking. So
Gotcha.
looking forward to it.
Well,
the nerve-wracking of public speaking. You know what I mean?
Yeah, at least it's over Zoom though. It's a lot like less stress, low barriers, you know. That's what I've seen.
I'm a little like confused. So are you two usually running like the SPM meetings?
Mm-hmm.
Ever since well, they stopped in February, of course, of last year, and then they just went silent and no one started back up with them. So in September, at the time, they were also changing over. They wanted to change the co-chairs. Michelle and James needed a break and to move on from it. So that's why they never started up virtually until Kelsey and I decided to do that in September.
Okay, understood.
Yeah.
You don't need to. But yeah, definitely. I'm pretty sure now I'll be in these meetings, so I'll definitely be seeing you two a lot more often. So again, it's a pleasure to meet you too.
Yeah, pleasure to meet you too, Franklin. Thank you for joining us.
Kelsey,
Bye.
what is that?
Huh?
What is that?
What is what?
Star?
Oh,
No,
that?
right there. No, right there.
That.
No, I'm just playing with you. Is that a Brazil philodendron? Or that plant that you have in the back?
Oh, it's a pothos, I think.
Those are fire. I love them. I have so
They're
many of
both
those at home.
pothos.
Yeah.
Yeah. They're the same plant.
Yeah, I can see the trailing. That looks really nice.
Thank you. Thanks so much.
Kelsey loves her plants.
And my partner has plants too, and every time, I don't know, if I touch them or if I do something or if my son touches them, she.
That's funny. That's funny.
Yeah, I'm not quite a plant mom.
Oh, plant mom, there we go.
I can't keep them alive.
I'm not too hot with the plants either. But.
I don't have the green touch.
I have a lot.
Well, I guess that's the last question I had. I know that the presentations for Work to Future and CET, are those like they are sent through email as far as like the flyers or presentations?
Say that again. What's the question?
Like the presentations for CET or SET and Work to Future, are those just based off of as far as like information being collected, are those sent to the emails spoke or typed in the chat?
Oh, yeah. So not necessarily. So what happens is they send me and Kelsey all the resources and or PowerPoints or whatever they want to be shared. And then I will send out a follow-up email to the spin list early next week, probably on like Monday or Tuesday. And then everyone on the spin list gets that. Are you on the email list?
I don't believe I am. This was sent to me through my program manager. She requested me to participate in it. So maybe maybe she is.
Okay, so can you, if you haven't already, can you throw your email in the chat, and I will be sure to BCC you on the email I send out. But in the meantime, it's super easy to get on the spin list. But to do that, I'll type in the email info.
I mean, if by list, do you mean like from time to time? Well, I mean, every day I get a notification from, I don't know, I guess the SPN regarding resources in the community.
Oh, okay,
Is that the list?
Yes. Yeah, so on that is the list, I believe. So on Monday I sent out the spin reminder email. Did you get that with like the Zoom link and everything?
No, I don't believe I got that.
Okay, so maybe you aren't on that. I'm not sure. That it doesn't hurt to just go ahead and email them. I'll send the email right now. Send email with your send email. Okay.
Yeah, because I get you know, the domain postmaster addresses, the emails.
Mm-hmm.
Yeah, I get those all the time. I just don't know.
That's strange. Maybe you are
Nicole Thomas.
Oh, I think those are different. You might be on a different mailing list. So Santa Clara County Continuum of Care hosts a bunch of they are the ones who manage this. This is why I can't like go and add you to it, because they manage it. But they also manage other email lists, like there's a COC email list, there's different ones. So if you just email info@santaclaracountycoc.org, say that you want to join the SPIN email list, the Service Provider Network one, because so that they know, because they manage multiple, and then just like specify, you know, your email address to add to the list. And they should add you pretty quick on that. But in the meantime, I'll be sure to, if you send me your email, I'll be sure to BCC you on the follow-up email, so you have all the information still.
Yeah, I just typed it in. I typed it earlier, but it's like all the way to the top.
Yeah, right. Okay. Let's see. Oh, actually, I do. I'm seeing it now.
Oh, you see it at the top?
Yeah, I scrolled up. I see it. Actually, hold on. But yeah, I'll be sure to BCC you on that so that you can get it too.
Yeah.
Elsie, Alexis, thank you again.
You're welcome. Have a great day, Franklin.
Y'all be safe, okay? Take care.